Bismillahirrahmanirrahim. Health planning cycle. I am Dr. Ahmad Wahid Khan, PGR MPH Community Medicine Department. My supervisor is Professor Dr. Saira Afzal. Learning outline. Introduction of planning cycle, steps of planning cycle, description of each step, recent updates, MCQs. Learning outcomes. At the end of this presentation, participant would be able to describe the planning cycle and its steps in detail. Introduction. The planning cycle is a systematic process which enable manager provider to determine how resources are used in relation to achieving their goals and objectives. Governments and NGO of the countries around the world are working together to maintain health system and health for all worldwide. It consists of series of 11 steps. The first six steps are sequential and their position should not be changed. The last five steps can be changed according to the need of the existing situation. Steps of planning cycle. Step 1 is planning the planning. Step 2, review of the policy guidelines. Step 3 is situation analysis. Step 4, review of resource availability. Step 5, development of intervention. Step 6, setting plan objectives and targets. Step 7, determination of resource requirement. Step 8, adjusting the management and organization system. Step 9, preparing for the budget. Step 10, developing the plan of operation. Step 11 is planning for monitoring and evaluation. Step 1, planning the planning. Planning the planning stage deal with prerequisites that have to be in place and issues that have to be resolved before the actual planning exercise may start. The objective of planning the planning is to ensure that the planning process can be carried out smoothly. Before planning can start, the planner needs to establish the identity and position of planning body, the district health management team. The district health management team is the administrative body for all health matters in a district. It is not an elected body but is constituted by the EDO health. The DHMT has a core and extended team. The core component comprises member working within the district health office, while the extended component include all other members of DSMT. Role of DSMT, the number one is to determine the specific terms to reference of the plan, including objective, purpose, target group, and time period of the plan. Identify resource available for timing, task, and responsibilities of the planning exercise. Assign specific task responsibilities to each member of the planning body, evaluating the planning process and prepared plan. Step 2, review of the policy guide. Review of the policy guidelines is a process of familiarization with directives and conditions that prevail and must be followed in the preparation of district plan. The purpose of such review is to ensure that the district plan is in line with the national or provincial policy guidelines. Despite establishment of devolved government at the district planner need to review national and provincial guidelines, review provisional programs. Step 3, situation analysis. The situation analysis is the process of analyzing and interpreting all information available from the various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. Purpose of situation analysis is to identify the health problem and health service need arising as a result of these problems, to determine causes and circumstances underlying problem in the health situation as well as with the delivery of the health service, to assess availability and adequacy of resource in the light of health service need, to identify the gap and weakness in the healthcare services in line with health problems and service needs. Part of situational analysis is The situation analysis consists of a descriptive and analytical part. The descriptive part describes the situation as at present. This help in assessing the magnitude of the problem, which in turn help in prioritizing the problem. The analytical part deal with the factors that determine the existing situation and is used subsequently for developing appropriate intervention. Source of information for situational analysis are vital statistics, census, health information system, hospital records, health system review, also called the health system analysis, special survey in the field, qualitative method for data collection. Component of situation analysis. It is useful to consider a situation analysis under the following four components as later it may be helpful while preparing the situation analysis report. A is determine existing problem, B prioritize problem, C is ascertain available source for addressing existing problem and identify weakness and strength of the existing system. Important criteria for ranking health and nutrition problems are magnitude in terms of the proportion of the general population or of specific subgroup of the population such as women, preschool children, school children, the elderly, etc. are affected. Severity, danger to the individual and the community. How serious is the condition? Does it threaten life? Cause major suffering and decrease the ability to lead a normal life, reduce productivity. Vulnerability to intervention. If a problem is not vulnerable to intervention, it makes little sense to include it in the list of those target for action. Four is cost of intervention expressed in the term of cost effectiveness must continuously be kept in mind in the prioritizing of problem and policy expediency. Even if a problem fulfill all of the above criteria, if it is not recognized, such as the district or higher authority, it is very difficult to include it among the high priority list, even when such action goes both against wisdom and common good. Step 4 is review of the resource availability, a preliminary process to assess resource availability that would assist in determining the scope of the district plan and selection of the intervention strategies. The objective of reviewing the resource availability is to enable the planner to stay within the frame of realism and limits the available resources in the development of intervention packages. Step 5 is developing intervention. It is a process of identifying, shortlisting, and developing intervention measures from among the variety of potential intervention. The objective is to identify and develop the most appropriate interventions and intervention packages for existing health need. Planner shall now identify and work out intervention measure and package that can be best address the both. Select the appropriate intervention strategies to address the priority problem, adjust the existing services, establish additional service, and overcome constraint to effectively implement the appropriate intervention strategy. Step 6 is setting plan, objective, and target. Setting plan objective is the process of defining what one wants to achieve. Sometimes also refer as a expected result within the plan for periods of time in light of earlier identified health need priorities and prevailing resource constraint. The main purpose of setting objective will be highlight what planner wish to achieve, quantify these and enable a focused selection of input and activities that will bring about these. Plan objectives are set in order to provide the planning body with a list of results likely to be achieved through implementation of the plan in the course of plan implementation period. Determining the plan objective, health status, service activity management and organization, sports system, involvement, inter multi-sectoral integration. Example is improve reproductive health service in district Rajanpur. Long-term objective is to maternal mortality shall be reduced from the current 340 by 1 lakh to 300 by 1 lakh within 4 years from 2001 to 2004. Short-term objective are all pregnant women in all villages of the district are given advice and refer to antenatal service within the first year. By the end of 2003, 88% of women delivering in villages of the district are assisted by a trained TBA. To reduce the maternal mortality, it had been decided that midwives have to be trained and regularly monitored, and that tetanus immunization, prenatal care, and emergency obstetric referral system shall be provided. DHMT now has to determine all of the following targets: number of midwife to be trained, number of training session to be held, number of tetanus injection to be given, number and frequency of prenatal visits, percentage of obstetric complication to be seen in a THQ DHQ hospital. Only if activities are carried out in the right number can the outcomes necessary to reach the objective, that is reduce maternal mortality, be reached. Outcomes would be coverage of 80% of pregnant women with at least two injection of tetanus toxoid, 80% of women delivered by a trained TBA, 70% of pregnant women attending antenatal clinics, 60% of complicated pregnancy referred to and managed at THQ hospital. The impact on the other hand would indicate the percentage reduction of MMR. Matching target to performance standard. Planned service target should be matched against expected potential performance standards using the available mix of resources. If the planned target are higher than the potential number of serving that can be delivered, giving available or potential resources and under prevailing constraint, objective need to be modified to allow between planned service target and potential performance levels. Step 7 is to determination of resource requirement. Identification of resource requirement is the systematic process of translating planned activities into the resource need. The purpose of this section is to identify to what extent existing resources cover planned intervention packages and to what extent additional resource shall become necessary. Step 8 is adjusting the management and organization system. The management and organization system is the coordinating center for all health service activities. The executive district health officer head it with the assistance of a team of district managers. The main purpose of M&O system is to ensure maximal efficiency and effectiveness of the healthcare system deliveries. Adjusting M&O function and activity among several functions of the M&O system, the more important one addresses manpower, money, and material issues, and functioning of the support system in general. Support system include monitoring and supervising collection and analyzing reporting of the HMIS data and or the information from health system analysis, ensuring a functional referral system, repair and maintenance, drug and contraceptive supply system, coordination of activities, coordinating different organization or sectors, community mobilization include in what areas and what activities should the community get involved with the improvement of or delivery of the health care. What action are expected from the community? How many community involved in to be monitored? At what frequency and when are meeting with community representative to be held? Step 9, preparing the budget. Preparing the plan budget is the process of translating input, target, and activities into the money. The main purpose of budgeting is to identify the overall financial requirement by plan, period, and individual year. Identify financial requirement by the line item and by specific program and enable performance budgeting. Step 10 is developing the plan of operation. A plan of operation is written summary of the implementation plan specifying sequence and timing of the responsibilities for implementation of main objective, expected results, and activities. The plan of operation serves to enable the plan implementing team to carry out all activities associated with the execution of the district plan according to predetermined criteria of time, quality, and quantity. The operation plan provides a set of ready guidelines for the day-to-day running and periodic assessment of the functioning of health service for the plan implement. Plan of operation are derived from the target and activities such as reflected in table 12b and further elaborate on the following operational aspect of the plan information and target and activity metrics. What is to be done, how that has to be done by whom to whom, when, through what means, according to what quality control measures. Information is Gantt chart by whom, when, how often, over what period of time. Step 11 is planning of the monitoring and evaluation. Monitoring and evaluation is a quality control mechanism and form of part of management and organization responsibilities. Because of its importance for the success of health interventions, it is being elaborated here in great detail. The purpose of M&E is to render healthcare as efficient and effective as it possible within given ecological and resource constraints. Monitoring and evaluation serve to assess whether the first four components of the healthcare delivery system, input, distribution, output, outcome, as well as the support and management and organization system are in place, are functional, and match earlier established quality criteria. As such, it helps to determine whether the objective and expected result are being reached, verify whether the plan are being implemented in the way and manner they were planned to be implemented, ensure that all components of the health service delivery system are in place and functional, and identify the problem early enough to allow correction. SWOT analysis is a framework for identifying and analyzing an organization's strength, weakness, opportunities, and threats. These words make up the SWOT. The primary goal of SWOT analysis is to increase the awareness and of the factors that go into making a business decision or establishing a business strategy. It should be specific and avoid gray area. To do this SWOT analysis, the internal and external environment and the factors that can impact viability of the decision. Recent update enabling ambient intelligence of things healthcare system architectures. Abstract during the last decade, significant research has been conducted in the field of healthcare and the administration of cutting edge ambient intelligence technology. Healthcare experts explored smart gadgets and other medical technologies as well as ambient intelligence using the Internet of Things. The potential for linking the two region and improving care for individuals living in rural and distant areas is apparent. The healthcare industry has been tremendous advances in efficacy, affordability, and usefulness as a result of new growth possibilities and drastic cost reduction. This include how to guide on how medical advancement may be both helpful and detrimental as a result of alert-based technology. The alert as application is anticipated to be covered in the last section since it has the ability to assist with the current and varied technologies and relevant approaches for solving healthcare problem are examined. Furthermore, many potential problems and inconsistencies with the alert edge method are often identified. Current and future academics interest in the subject will be able to examine a wide range of possible alert edge implementation in order to get a better understanding of the effect and influence on any of the many alert applications. Now it's time for MCQ. Question number one. Governments and NGO of the countries around the world are working together to maintain the health system and health for all worldwide. The process of thinking regarding the activities required to achieve a desired goal is which of the following? Options are option A is funding, option B is planning, option C is criticizing, option D is evaluation, option E is policy guideline.
B. Planning.
Yes, the correct answer is planning. Question number two. The planning cycle is a systematic process which enables managers, providers to determine how resources are used in relation to achieving their goals and objectives. Which of the following has the objective to ensure that planning process can be carried out smoothly in a planning cycle? Option A is plan the planning. Option B, education of people. Option C, situation analysis. Option D, political involvement. Option E is resource availability.
C. Situational analysis.
Situational analysis.
The correct answer is A, plan the planning. Question number three, situation analysis is the process of analyzing and interpreting all information available from the various sources on the current situation of the health system as it prevails within the specific geographic area under consideration, which of its type help in assessing the magnitude of the problem, which in turn help in prioritizing the problems. Options are A is qualitative, B is quantitative, C is analytic, D is descriptive, E is vital statistic. D.
A.
Correct answer is D. Question number four, a Gantt chart is a type of bar chart that illustrates a project schedule. It determines team. It helps team to plan work and properly allocate resources to maintain a bird's eye view of the project. It contains the project task on the vertical axis and on the horizontal axis it represent. Option A is perform task. Option B is time duration. Option C is name of organizations. Option D pending task and option E is task name.
Time duration.
Yes, the correct answer is time duration. Question number five. One of the four components which help in making the situation analysis report is problem prioritizing. Important criteria used to prioritize the health and nutrition problem includes all except magnitude, severity. C is political will. D is personal preference. E is vulnerability to interventions.
Political will.
Correct answer is the personal preference. Question number six is the objective of reviewing resource availability is to enable the planner to stay within the framework of the realism and limit of available resources in the development of intervention package. The resource availability include all except option A is manpower, option B is material, option C is methodology, option D is money, option E is physical resource.
Methodology.
C.
Yes, correct answer is C. Question number seven. During COVID-19 pandemic, health planning team XYZ is responsible to review regarding availability of vaccine, vaccinators, and supervisor, and on daily basis update of the data. The main purpose is to ensure maximal efficiency and effectiveness of the healthcare delivery system. This task comes under the responsibility of which of the given boards? Option A is Developmental Intervention Board. Option B is Review Policy Board. Option C is Management and Organization Board. Option D is Finance and Budget. Option E is Executive District Officer.
C.
C is the right answer. Question number 8. Monitoring and evaluation is a quality control mechanism and form part of management and organization responsibilities. The purpose of M&E is to render healthcare as efficient and effective as it possible within given ecological and resource constraint. All given are function of M&E except option A is whether objective and accepted results are achieved. Option B identify that all components of the healthcare system are in place and functional. Option C is political involvement. Option D is identify problems earlier to allocate correction. Option E is help define a project scope.
C.
The C is the right answer. Question number 9. SWOT analysis is a useful analytical tool to qualitative and quantitative examine and assess the system such as the district health system with respect to all of its individual system. The component, which of the following is true about preparing a SWOT analysis? Option A should be focused on whether the organization is today, not where it could be in the future. B is a SWOT analysis, the objective. C is it should be specific and avoid gray areas. It should be analyze the organization only and ignore the performance of competitors. And option E is it only analyze the gray area. The correct
C.
answer is C. Yes. Question number 10. The main purpose of the M&O system is to ensure maximal efficiency and effectiveness of the healthcare delivery system. It is a function of management which refer to the process of integrating the activities of different unit of organization to achieve the organization goal. This is called option A is activating, option B is controlling, option C is coordination, option D planning, and option E is developing intervention.
C.
C is the right answer. This is a key of the MCQs. These are the references through which this presentation has been made. Here is the link of our YouTube channel. Thank you.